I think there's a number of things that make Hurley's program unique. One is that we have a large urban population that has a lot of medical needs, and so there's a lot of clinical pathology that the residents have an opportunity to work with. They also have universally an opportunity to work one-on-one with all the specialty faculty. So it's an intimate atmosphere that can also take into account individual resident learning needs, scheduling issues, and provides a very broad opportunity for them to learn and practice across inpatient and outpatient settings. Pediatrics at Hurley is a relatively small program compared to many programs across the country. We have 5 residents in each class. Well, the curriculum of the pediatric program complies with all the RRC guidelines, and so the required experiences are given to the residents over a 3-year period of time, including inpatient and outpatient experiences, subspecialty experiences in pediatrics, and graded supervision so that over the course of 3 years the residents have increasing responsibility for patient care for supervising junior residents. They have opportunities over the 3-year experience to really be the person in charge of gathering the data, coming up with a differential diagnosis, and designing a treatment plan. They're always supervised by an attending physician, but we really have a strong expectation that our senior residents are going to be primary caretakers for their own patients. And what I've seen in our graduates is a very high level of clinical decision-making and clinical competence. Instead of consulting a specialist, they actually have to go through the process of making a diagnosis, thinking of the differential, and coming up with a treatment plan. So compared to some larger university programs, I think our graduates actually are better prepared to hit the ground running in terms of their clinical practice. Our faculty represent most of the required subspecialties. Those that are not available on site, we import from neighboring institutions to come in and do ambulatory clinics and inpatient consultations. They're board certified in their specialty areas. They are very attuned to working with house staff. I think it's fair to say that most of our faculty, if not all of our faculty, would not be here if there wasn't a residency training program. They're all very invested in working with young physicians and actively being involved in their education. Residents are expected to have some experiential learning in scholarly activity, learning some of the skills of how to work with the medical literature and critically appraise it, but they certainly have an opportunity above and beyond that to work on individual projects with faculty members or to pursue their own individual interest, either in the form of case reports and local presentations, all the way up to small studies or participating in presentations at national meetings. The program has a vested interest in our residents doing well and in being nurtured professionally and personally during the time they're here in training. And because we're a small program, I think that's something that we achieve with great success.